Welcome to AETCM, the Emergency Medicine channel. In this video, we are going to discuss about the New Orleans criteria. So this is a clinical tool which is used to assess the patients with minor head injury to assess whether these patients are requiring a CT radiological imaging or not. So we'll be looking on to 4 parameters. If any one of these are present, we have to consider CT imaging for such patients. So this criteria, the New Orleans criteria, is only applicable for patients with GCS score of 15. So coming to the parameters, if there is headache for the patient post-injury, we have to consider the CT. And next parameter is vomiting. If the patient had 1 or more episodes of vomiting after the injury or after the event, we have to consider a CT. Next is age more than 60. So people or patients belonging to this age category is very likely to have an intracranial bleed easily. So we have to consider the age that is more than 60. Coming to the next, if there is drug intoxication during or after the event, because it can mask the neurological deficit if present or not. So if drug intoxication is present, we need to consider CT for such patients. Coming to the next, that is amnesia. If there is amnesia or forgetfulness for the patient after the event, we have to consider a brain CT. Next is if there is a visible trauma above the level of clavicle, that is in the scalp or face. If you are able to see the trauma, you have to suspect or the patient would be likely to have, there is a probability of having a skull fracture or intracranial bleed. So in such patients, we have to consider a CT imaging. And the next is if the patient had seizures after the event or injury. So the post-traumatic seizure has to be taken into consideration. So if seizure is present or seizure was present for the patient, we need to consider a CT imaging. So I'll sum up everything again. If there is headache for the patient, if there was episodes of vomiting for the victim, or if the age of the patient is more than 60 years old, if there was drug intoxication, if the patient had episodes of amnesia, or if the patient had amnesia post-injury, if there is a visible injury above the clavicle, above the level of clavicle, and the last one, if the patient had seizures after the injury or after the event. So in all these scenarios, if any one of these are present, we have to consider CT imaging for patients. So again, as I told, this New Orleans criteria is only applicable in patients with a GCS score of 15 who are adults and who are having a mild head injury. So hope this is clear. Thank you for watching.